People exposed to the coronavirus can now return to work up to a full week early.
The CDC has shortened its recommended quarantine period for COVID-19. News 8's Julia Deng is here with the new guidelines and their impact on schools. Julia.
Yeah, Brooke, that window is now 7 or 10 days, depending on the status of testing and symptoms, instead of 14.
Thought, boy, I wish I would have had that update about a week ago.
Governor Eric Holcomb quarantined for 14 days after possible COVID exposure, despite negative test results. That's what the CDC recommended at the time.
Today, the CDC has issued new guidance.
Quarantine can now end after 10 days if you're asymptomatic and haven't been tested, or after 7 days if you're asymptomatic and test negative on days 5, 6, or 7.
Under this new guidance, the 14-day quarantine is still available and should be used by people who encounter high-risk individuals, such as someone who works in a cancer unit or is immunosuppressed.
Laid-off restaurant worker Jimmy Alvarez has scarred lungs.
My initial reaction was that I kind of just wanted to stick to 14 just to be safe.
She feels the new recommendations are more realistic for workers who don't have paid leave, but she hopes people who are able to will still isolate for 14 days to protect the vulnerable like her.
I'd rather be safe than sorry, honestly.
But that added sense of security can come at a cost.
I think the most difficult part is that you also are eliminating a teacher out of the classroom for 14 days in a lot of cases. So schools had to shut down because they couldn't find the subs.
Former teacher Don Wettrick applauded the new guidance.
4 days more, they can go back to work.
The state health commissioner agrees. Shortening quarantine can improve the quality of education without sacrificing safety.
I really think that this is going to help us get more kids back in school sooner. So I'm very, very excited about that.
And even before this new guidance came out, some healthcare workers were shortening their quarantine and going back to work because of staffing shortages. Now, the CDC says isolating for 14 days is still the safest option, but acknowledged not everyone can do that. Live in the studio, Julia Deng, Wish TV and WishTV.com, and be sure to follow us on Facebook.